All right, good morning. As everybody is joining, we're going to wait just a minute or so while everyone gets logged into Zoom for the webinar. Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on February 5th, 2021, and is scheduled to run from 10 a.m. until 11 a.m. We want to thank you for taking some time to join us for this webinar. My name is Steve Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. Since our last webinar, our country experienced a shift in the administration at the federal level with the inauguration of President Joseph Biden and Vice President Kamala Harris. Vice President Harris is the first African-American woman, the first person of Indian or South Asian descent to be elected as vice president. It's such a unique and amazing experience, and we should all take the time to acknowledge history in the making. Uh, on to some other matters. As mentioned in last 2 weeks ago webinar, we evaluated the need for weekly webinars and determined that these webinars can occur every other week. It will allow us at the CDE to still connect with all of you and bring you the most up-to-date information. An announcement will go out, but the next webinar is scheduled for Friday, February 19th at 10 a.m. Before I turn it over to Erica, we want you to know that we at CDE continue to support and understand that you are doing your absolute best either to stay open or to reopen. These are not easy conditions to work in, and so we appreciate everything that you all are doing, whether it is being at risk or supporting distance learning, or even doing both. We know that happens in a lot of cases. So, I mean, so many of you are working in programs. You're open, you're exposed to risk. And while we know it looks different in many counties, we know the administration is working to get vaccines out faster. We're optimistic for the increased attention the Biden administration is also placing on getting vaccines to states so that those who need it most can access it. We've taken time out of each webinar to thank you all for what you're doing. And while nothing will ever be enough, saying thank you will never be enough until we're through the pandemic. Just please know that we see you and know that we are doing our best to support your needs. I'd also like to take a moment to discuss the CDE, CDSS transition that's occurring on July 1, 2021. Governor Newsom appointed Dr. Maria Lupe Jaime Milham as Deputy Director over the newly created division, the Child Care and Development Division at CDSS, and she comes to CDSS from the Fresno County Superintendent of Schools. Much of the CDE family has had the privilege to work with Dr. Jaime Milham, and we're thrilled she'll be leading this work at CDSS. As a reminder, the CDSS family will grow with approximately 185 strong and talented staff moving to CDSS. Please know that we are all working collaboratively on a smooth transition. In order to ensure that we maintain a continuity of operations and uninterrupted delivery of services for families and children, the CDE and CDSS have participated in detailed and extensive walkthroughs regarding the programs that are moving over and how allocations will be distributed in order to minimize or mitigate disruption over the transfer. CDSS yesterday shared some highlights of the transition plan, and we know they'll be having their next stakeholder session in the coming months. In the meanwhile, we at CDE are continuing with our work on continuous improvement to the state preschool program as we look forward to July 1. We're looking forward to an announcement soon for an upcoming stakeholder session to gather input from you all and to help focus effort on those improvements. And with that, I'm going to go ahead and turn it over to Erica.
Thank you so much, Stephen. This is Erica Otieno, Associate Director for the Early Learning and Care Division of the Department of Education. Once again, I want to acknowledge the uncertainties and grief we have faced and continue to experience from this pandemic. Some of you have shared information about staff, parents, and family members losing their lives to the pandemic. Some program staff, just like many others today, have real need for mental health support. We recognize what you are doing. We recognize what you're going through, and we continue to commend you for continuing to serve children and families under these circumstances, for continuing to find new ways to support your community safely. We deeply appreciate and we're grateful to you all. The Program Quality Implementation Office, we call ourselves PQI Office, we have developed a set of resources for your use. You may find the resources posted on CDE's COVID website. And Crystal, if you're on, could you please help me put that on chat right now? You can also ask your consultant for that set of resources that we have compiled. Crystal Devlin, Interim Administrator on PQI, will be the administrator that will provide updates during the PQI session of this webinar. Again, I just want to thank you all. Thank you. Enjoy the session. And now I'm going to hand it over to Virginia. Crystal is experiencing technical difficulties, so we'll post that as soon as we resolve that technical difficulties. So now over to you, Virginia.
Awesome. Thank you so much, Erica, and thanks everyone for being here. I'm Virginia Early, the Administrator of the Policy Office in our division. Thank you so much for being here with us today. For those of you who may not remember, my office is lead over working with the Governor's Office, Department of Finance, and the Legislature on any new funding that may be coming to the field and any new new laws, and then of course implementing those through guidance in several different ways. So there's a lot going on right now that we're tapped with. I know that a lot of people are asking questions about whether we'll be discussing the two management bulletins that we released earlier this week, 2103 and 2104. I just want to say verbally, yes, we will be discussing those on this webinar. And now I'm going to turn it over to Alana, our moderator.
Good morning, everyone. I'm Alana Andrade, and I'm a child development consultant in the policy office here at ELCD. As I'm moderating our webinar today, we've got a great team answering questions and making our presentation run smoothly for you. From the policy office, we have Danielle Davis, Eric Dunk, and Barbara Lindsay. From the Program Quality Implementation Office, PQI, we have Crystal Devlin, Deborah Rosen, Mignon Pollard, Cassandra Lewis, Brittany Sheffield, Beer Zong, Richard Miller, and Katina Boulay. From the Child Development, Nutrition, and Fiscal Services, CDNFS, we have Corey Kahn, Andrea Johnson, and Alan Lynch. From the Child Development Management Information System, CDMIS, we have Robert Halm and Carly Nodahara. And here to answer any questions regarding nutrition or food programs, we have Shashi Sharma. And our team is committed to being as responsive as possible. As you see, we've already been answering some of your questions. A few reminders, please check the frequently asked questions, the FAQ webpage, to see if your question might have already been answered. In fact, we've updated our ELCD FAQ webpage since our last webinar. One of the new FAQs is regarding prioritization of CSPP families for in-person services. Is it by agency or is it by site classroom? You can find that answer under the enrollment reporting subheader, and it's question number 16. I'll ask Brittany to include that link for the FAQ page in the chat box for you all now. And as usual, when you're sending your questions to our team in the Q&A feature, please give us as much information as possible. Back over to Stephen to review our agenda today.
Thank you, Alana. So as you heard from Alana, we have a great team on, a big team on this webinar to address your questions and help prepare us for today and for each of our webinars. I always enjoy these webinars because it means I get to engage and work alongside this great team in another way. So as we normally do in today's webinar, you'll hear about our guidance updates as well as some fiscal updates. As mentioned, we'll be providing some updates from the policy office, our program quality implementation team, as well as some critical fiscal guidance and updates. After that, we'll review some questions that have come into the ELCD emergency email box. We're going to do our best to address as many questions as we can. You may also use, as Alana mentioned, the Q&A function in Zoom to put your questions in. Of course, anything that we don't get to, we will take back to address in FAQs on our website. And I'm going to turn back to Virginia for our next piece.
Awesome. So thank you so much, Steve. So where are the federal funds? That is a question that we have gotten so much in the last month. So many of you may be aware that on December 27th, Congress passed and the president enacted Consolidated Appropriations Act of 2021, which authorized $10 billion nationally for early learning and care. So there was an estimate from the Center for Law and Social Policy, which said California was expected to get $1 billion. Earlier this week, just 2 days ago, we actually got our letter with the exact amount. And California was awarded $964 million of these funds. So just a quick note about these, the funds have not been yet made available to CDE. We are working with the Department of Finance and the legislature to get those funds to CDE so that we can get them out to the field. And so the piece where there's a lot of conversation about is around some language that was in Senate Bill 820. So we can go to the next slide. So Senate Bill, or SB 820, Section 61 had language for additional federal funds. And so these next two slides, I'm going to walk you through what the language in Senate Bill 820 said about how any additional federal funds would be spent. Now, keep in mind that this language was passed last summer and fall, and so some of the priorities have been already met with $110 million that we got in federal coronavirus relief funds. But I sort of want you to be aware of kind of what is currently in statute. So there's 6 different priorities that are listed in Senate Bill 820. And so you see those here on the left side of the chart. The first one is they total to $300 million, which is obviously less than the total amount California will be receiving. So there'll have to be more conversations about how the rest of the 964 million is allocated. And so the first of these proposed investments was 30 million to reimburse providers for waived family fees for families that were in distance learning or sheltering in place September 2020 through June 2021. Many of you probably remember from our previous webinars that this has already been met with the previous 110 million in federal funds that that the state allocated for early learning and care in the fall. So that priority has already been met. Similarly, the second priority that's laid out in statute for any additional federal funds, there's 35 million set aside in additional funds for dual provider payments during the 14 non-operational day period. So that was added because at the time that Senate Bill 820 was passed, no one was really sure how much the 14 additional non-operational days would cost. At this point, our estimates are saying that the amount that has already been allocated is sufficient and these additional funds are not needed for this purpose. And then the third priority is 100 million to extend emergency childcare through June 2021 and enroll additional children in emergency childcare through June 2021. So again, this is one that has already been partially met with the 110 million that we got in federal coronavirus relief funds in the fall. So all children in emergency childcare have been extended through June 30th, 2021. And if you have any specific questions about how that is affecting your agency or that, please contact your fiscal analyst. So, so on to the next slide. So the next three priorities, there's 30 million to expand access to high quality direct contract programs like general childcare. So while I mentioned that CDE doesn't have the funds yet, we are doing as much work as possible at CDE to make sure that the second that we do have the funds, we are ready to go. And so looking at this language in Senate Bill 820 about how the legislature said they wanted the funds to go out if we were to get them, we are re-looking at applications that we got for general childcare, our CCTR contract expansion in 2019-20 to save time in getting these funds out to the field. So rather than doing an entirely new RFA process that people would have to apply for and would slow down when we know there's so much need right now, we would look at applications that we were unable to fund in 2019-20. So specific to that one, to get as ready as possible for when the federal funds will be released, we will be sending a survey to contractors who applied for CCTR expansion in 2019-20 and who had passing scores. There's a priority in Senate Bill 820 that the funds go to existing CCTR contractors with who are serving infants. So we'll be sort of reading the applications with that lens to see who's meeting that priority for infants and toddlers and our current contractors. And we'll be sending out a survey to make sure that we have the most up-to-date information and ask any additional questions about items that may be needed to implement the requirements of SB 820 Section 61. So, and again, like I said, we're just trying to do as much work as possible in advance of the funds arriving at our department so that when we have the funds, we're ready to go. The fifth and sixth priority are both related to stipends. So there's 15 million in reopening stipends and 90 million in stipends to support increased costs due to COVID-19. For both of these stipend programs, we're working with the legislature and the administration to ensure that any additional resources for stipends are issued as quickly as possible to the field. And we've been providing technical assistance and having conversations to make sure that any additional funds can go out as quickly as possible. So I suspect we'll have a lot more to say about about these funds in our next webinar, but we wanted you to be aware of, even though there are ongoing conversations, we wanted to share with you what the language from Senate Bill 820 is on how, at least in the summer, the legislature expected additional funds to be spent, and where we've met some of those already, and where there are items that have not been yet, such as the 30 million expansion for CCTR. I will now turn it over to Danielle to discuss Management Bulletins 2103 and 2104.
Hi there, everyone. I'm going to start with Management Bulletin 2103, and this Management Bulletin pertains to 12-month eligibility. There's some three notable things that this Management Bulletin has changed, which it now implements a statewide abandonment of care policy, it removes contractor policies for unexcused absences, and it updates the recertification timeline. This Management Bulletin applies to all direct service contractors and alternative payment program contractors and providers. So this would include our general childcare contracts, state preschool contracts, fetch-in contracts, our CHON contracts, center-based migrant contracts, CalWORK Stage 2 and 3, alternative payment program contracts, and our migrant alternative payment program contracts. It's important to note that this Management Bulletin does rescind Management Bulletin 1714, and while many of the policies remain the same, this Management Bulletin does have a few notable changes. The first change is that the Management Bulletin implements an abandonment of care policy. So just a general overview of this policy is that it requires providers to notify contractors when the family has not been in communication with the provider for 7 consecutive calendar days and has not notified the provider of the reason the family is not using services. So from there, the contractor is then required to attempt to contact the family using a variety of communication methods, and at least one of these attempts must be in writing. Note here that communication methods can include electronic methods, and to clarify, the requirement for one attempt to be in writing can also be done through electronic methods. So this is not something that needs to be hand-delivered to the parent or doesn't need to be mailed out. You can choose to do that if that's the method that you choose, or you can send it electronically to the parent if they have an electronic means to receive it. If the family has not contacted the contractor after 30 consecutive calendar days, then the contractor is required to issue a notice of action to disenroll the family on the basis of abandonment of care. And something else to note from this Management Bulletin is that contractors are required to notify all families of this new abandonment of care policy by April 2nd of 2021. So you can find the abandonment of care policy in section 18066.5 of the implementation guidance in Management Bulletin 2103, and I highly suggest that everyone take the time to read through and understand the sections in that Management Bulletin that have been updated, as those are new policies for our contractors. The second thing that the Management Bulletin does is that it removes the contractor's ability to develop policies that would disenroll families due to unexcused absences, except in instances when the family has abandoned care. This provision can be found in 18066 of the implementation guidance found in 2103. And again, I would encourage all contractors to go and read through those sections. And then the last thing this Management Bulletin does is that it updates the recertification policy to require recertifications within 50 days following the 12-month eligibility period. And further, it requires that contractors notify families in writing within the final 30 days of their 12-month eligibility period of 6 things, so that they have to notify the parent that the family must be recertified to continue receiving services, the date of the recertification that it has to be completed by, the date of the recertification appointment. They have to notify the family any information that the family needs to know about the recertification process, and then which includes any information required or documentation that the family needs to gather in order to be able to complete that recertification process. And then finally, a phone number or an email address for the contractor in case that the parent has any questions regarding recertification. These specific changes to the recertification process can be found in section 18103 of the implementation guidance in Management Bulletin 2103. And then the Early Learning and Care Division is currently finalizing some FAQs to accompany this management bulletin. We understand that there's a lot of questions coming in and a lot of questions popping up for contractors. So we just want to notify you guys that we are working on those FAQs, and we will let you know when those are posted and they're updated on the FAQ webpage. If you have any additional questions about this management bulletin, please ask them in the Q&A feature. I cannot promise that every question about this management bulletin will be answered today during this webinar, but I can assure you that all of these questions will be taken back and looked at for additional FAQs and maybe put on the FAQ page if it's a question that we get asked a lot, or there will be other means like the next time we have a webinar, we may answer additional FAQs. So there's always another opportunity, and we definitely want to hear any questions that are coming up from you guys about it. And then I'm going to send it over to Corey because I think there's something else we need to add about this.
Yeah, thanks, Danielle. So I've kind of been monitoring the chat too, and so we have received questions today and previously just about how this abandonment of care policy that Danielle just went over affects contract reimbursement. So contractors are reminded that this policy will not affect reimbursement for fiscal year 2021. And that's because reimbursement to direct service contractors is based on the lesser of cost and MRA. So contract maximum reimbursable amount, so MRA. And it does not take into consideration enrollment or attendance levels. So that's for fiscal year 2021. And I know many of you are probably thinking already about next fiscal year. So how is this going to affect next fiscal year? I wanted to let everyone know that we have not updated our reporting procedures for next year, but we will update reporting procedures to make it clear on how to report the days associated with abandonment of care. And we want to assure you that we don't want this change to impact reimbursement. So that's going to be on the top of our minds when updating any necessary reporting procedures. So that's reimbursement in a nutshell. So I'm going to turn it back over to Danielle to go over another management bulletin.
Thanks, Corey. Okay, so I'm going to go on to the next management bulletin 2104, which is regarding state preschool eligibility criteria. So something to note here that this management bulletin is only applicable for our state preschool contractors. If you hold a contract that's not a state preschool contract, this management bulletin does not apply to you. The information in this management bulletin, it's important to note that it is basically the same policies that were in Management Bulletin 2001, and it has rescinded that management bulletin. So all of the policies that were in 2001 are now reflected in this Management Bulletin 2104, and the majority of the policies have stayed the same, but the management bulletin does have two notable changes to be aware of. The first being that during this program year only, so the 2020-21 program year only, transitional kindergarten and kindergarten age children may remain enrolled in CSPP if there are specific conditions met by the contractor and the family. So for Part Day CSPP, transitional kindergarten and kindergarten age eligible children that were initially certified by October 30th of 2020 may remain in Part Day CSPP for the remainder of this program year if, number one, the contractor has made every attempt to transition the child to another subsidized program that the child is age eligible for but has been unsuccessful. Two, the contractor does not have a school age CCTR contract or does not have space in their school age CCTR program to serve the TK and K eligible children. And three, that the family would not have access to subsidized childcare or in-person TK or kindergarten options if they were disenrolled from our CSPP program. The requirements for Part A programs can be found in section 18130.5 of the CSPP implementation guidance found in Management Bulletin 2104. And note that I'm giving you guys all the section numbers so you can go to those specific sections to see exactly what I'm talking about, and so that you can see how they're laid out in the Management Bulletin for easy finding. And then note in that management bulletin, we have separated out requirements for full day and part day. And even though they're pretty much duplicative of each other, we did separate them out. So it is a different section for full day. And I'm going to read through some of the requirements for full day programs. So for full day programs, the contractor must not disenroll currently enrolled children if the contractor has made every attempt to transition the child to another subsidized program and that the child is age eligible for, but has been unsuccessful. And 2, the contractor does not have a school age CCTR contract that they can move these TK and kindergarten age eligible children to, or they don't have space in the CCTR school age program. And then 3, the family would also have to note that they do not have access to another subsidized childcare program or in-person transitional kindergarten or kindergarten if they were disenrolled from the state preschool program. Families enrolled in full day CSPP that meet those requirements will be allowed to remain in CSPP without being recertified for the 2021 program year. Because these families are, at the way our current statute is written, these families are not technically age eligible for CSPP. So we want to make it very clear that in this management bulletin, it allows them to stay, but they should not be recertified this program year. They will just be allowed to stay till the end of the program year. The requirements for full day programs can be found in section 18130.6 of this implementation guidance in 2104. And then the second notable change is that the recertification requirements from Management Bulletin 2103 have been updated. So therefore, it's important to note that all families in full day CSPP that are required to recertify will follow the new recertification guidance in section 18103 of the 12-month eligibility implementation guidance in Management Bulletin 2103. So besides those TK and kindergarten eligible children, every other child that's in full day CSPP should be following the recertification guidance that has been issued in 2103. To go along with this management bulletin, we know that a lot of questions have come in about how to report in CDMIS these children. Do you have to go back and retroactively report? And the answer is that to that question is yes. So contractors will need to report all TK and kindergarten age eligible children that have been receiving services this year, including for the months that you may have already submitted a report. So the reports for July 2020 through September 2020 will be open for contractors to report retroactively for approximately 1 month after the release of this management bulletin, give or take a week or two. But they will be closed out earlier than the rest of the reports because we have federal reporting that needs to close out those reports so we can report federally. It's been brought to our attention, however, that some contractors have attempted to report kindergarten age children already and received an error message. So please know that if we are working on resolving this minor glitch in CDMIS, so if you see an error message when reporting kindergarten age children, please just send a quick email to our CDMIS team and they will notify you as soon as that glitch is fixed to make sure that you can go back in there and report those kindergarten age children as soon as possible. We are also finalizing some FAQs to accompany this management bulletin as well, and we will notify you guys also when we have posted them to the FAQ page. Again, if you have additional questions about this management bulletin or management bulletin 2103, please ask them in the Q&A feature after the webinar is over. And if you have any additional questions on either of these management bulletins discussed today, please send them to elcdemergency@cde.ca.gov so we can add them to our list of frequently asked questions to be able to update you guys on the answers. Okay, so that is it for the 2 management bulletins, and I'm going to send it on over to Crystal, who's going to provide some PQI updates now.
Thank you, Danielle, and good morning, everyone. As Erica shared, the PQI office has developed a mental health resource document for program staff and families. Unfortunately, I'm currently having technical issues and I'm unable to post this document in the chat. However, please do reach out to your PQI consultant to request a copy. And in the near future, this resource will be posted on the ELCD resource webpage. I will now provide PQI office updates regarding monitoring and training. The PQI office continues to conduct federal program monitoring, FPM reviews, and contract monitoring reviews, CMRs, for the remainder of fiscal year 2020-21. FPMs are designed for local education agencies and are organized and led by the California Department of Education FPM office. The Early Learning and Care Division Program Review Instrument is used to conduct the FPM, and the CDE monitoring tool, CMT database, is used for the agency to submit documentation, communicate with the review team, and is used by the CDE to record any findings. In typical years, the FPM is conducted both online and in person. However, due to the COVID-19 pandemic, all FPMs are being conducted remotely for the remainder of fiscal year 2020-21. CMRs, or contract monitoring reviews, are designed for LEAs, for-profit agencies, nonprofit agencies, and other public entities that hold contracts to provide early learning and childcare services with the CDE. CMRs are scheduled based on selection criteria categories, which we will talk about more in a moment. As with the FPM, the ELCD program review instrument is used to conduct the CMR. In typical years, the CMR is conducted on site, usually lasts about 1 week, and includes both a programmatic and an administrative review of contractors' performance. As I said earlier, the CMR is scheduled by the CDE based on selection criteria categories, which include alternative payment agencies that were scheduled for review in the previous fiscal year, but were not reviewed, direct service agencies that were scheduled for review in the previous fiscal year, but were not reviewed, agencies whose contracts are on conditional status, agencies that have not been reviewed in the past 4 years or more, and agencies with pending fiscal, monitoring, and or audits non-compliance, which are called follow-ups. Due to the pandemic, we are conducting all CMRs remotely this fiscal year and will continue to use the ELCD program review instrument to monitor each item as it pertains to the agency's contract type. Contractors that are scheduled for a contract monitoring review are notified by email no less than 60 days prior to the scheduled review. For remote CMRs, we are using 7-Zip software, and instructions are included in the review notification so contractors can prepare for the CMR. If you are scheduled for a review and haven't used 7-Zip software in the past, there is certainly a learning curve, as there has been for us, so don't hesitate to contact your consultant for guidance and support as you navigate the process. The CDE ELCD training team will be offering at least 2 additional trainings via webinar for fiscal year 2020-21. The first webinar is scheduled for February 17th from 1 to 3 p.m. The topic, Quality Practices During the COVID-19 Pandemic, will include strategies for meeting the Title V requirements for program quality during these difficult times. The second webinar will cover the program self-evaluation requirements for fiscal year 2020-21 and will be presented sometime in March or April. Prior to this training, around March 1st, the PSC Management Bulletin that provides directives for completing the PSC will be released, and the training will provide information on how to complete and submit the PSC. That's all for current PQI office updates. I will now hand it over to Mignon, who will discuss the cleaning supplies and childcare providers update.
Good morning, everyone. I'm Mignon Pollard. I am your consultant in the PQI office North. And the update, the apportionment.
Mignon, we can barely hear you. Can you get
Okay.
closer to your microphone?
Oh, okay. I think I will.
I don't know, maybe you have headphones plugged in that you're not next to or something.
Go ahead, Mignon. Oh no. I guess there's a lot of technical difficulties coming around. Mignon, are you able to speak? Well, while we're waiting for Mignon to come, I do have her talking points, so I'm just going to start reading them while we wait for our fabulous Mignon to come back. And as we all know, sometimes technical difficulties happen at the best of times. So for the SB 89 cleaning supplies for childcare providers, the CSCP update, the R&Rs have been asked whether essential workers have priority for resource and referral services, such as accessing ongoing subsidized or non-subsidized childcare services that meet the family's needs. So here you can see that for our apportionment, if the amount was about 50 million, there was also the total expended to date is about 44,354,694, and the total unspent funds is 5,645,306. There were 2 counties that overexpended, and a majority of the counties underspent. And currently we have reports from all counties, and there are still several that are under review at PQI. If there were any questions, we'll reach out. Next slide, please. I think it is time for Corey, and I think we are, Corey is here.
Yes, thank you, Alana. This is something that was brought up a couple weeks ago. I think at our the last webinar of the year, we kind of mentioned that we would have an update about stipends or hazardous pay, because we were receiving a whole bunch of questions about whether stipends and or hazardous pay are an allowable expense to charge to the early learning and care contract. So this slide kind of outlines the 2 different terms. So stipends, well, so let me back up. So early learning and care contract funding terms and conditions require that all contractors adhere to federal and state requirements and regulations. And so federal regulations require stipends to be pre-approved. And given that we really haven't pre-approved any stipends, the contractor should not issue stipends to employees utilizing CDE contract funds. So, however, contractors may use or may issue hazardous pay to employees, which is consistent with California Code, or sorry, Code of Federal Regulations 2 CFR 200.430, if you have funding to do so within your contract. So please note that hazardous pay applies to those directly employed by the contracting agency and does not apply to providers. So that's just the 2 distinctions of the 2 different terms. So stipends, not technically allowable because they weren't pre-approved, but there is something that hazardous pay to employees that is allowable. So I'm going to go into a little bit more detail on the next slide about hazardous pay. So as I said, federal regulations 2 CFR 200.430 and subsequent guidance that has been provided throughout the COVID-19 pandemic does support the compensation and extra pay, so long as the agency ensures that the compensation is reasonable for the services rendered, is paid pursuant to an agreement entered in good faith between the agency and the employee. It conforms to established written policies and procedures of the agency and is consistently applied to both federal and non-federal activities. So contractors may develop written policies and procedures that include the beginning of the pandemic, if necessary, in order to comply with these regulations and issue hazard pay. So as stated in the 4th bullet on the screen about being consistently applied to both federal and non-federal activities, contractors must not differentiate between the funding source of each employee for the purpose of determining hazard pay for employees. So meaning if a contractor has 2 employees with substantially similar duties and the employees are funded by 2 different income sources, the 2 employees must receive this similar hazard pay regardless of the availability of funds within each income source. So meaning, again, hazardous pay should be reasonable and implemented fairly for all impacted employees without regard to the funding source. So now I'm going to go into the status of the remaining $110 million allocation. So as communicated in the November 23rd, 2020 email titled Interim Guidance on the Distribution of New Federal Funds to Support State Subsidized Childcare and Updates on Pending Allocations, we received $110 million appropriated for various purposes. And based on the data reported to CDE, the $110 million is sufficient to cover the following for all impacted contractors. So we received submitted data from our contractors, and those that did submit data for the specific purposes will receive funding to cover the cost of 30 million. So we got 30 million to cover the cost of waived family fees for families not receiving in-person care, so that contractors and providers do not have to absorb the fees, the waived fees as stated in SB 820. So we will be allocating that. Allocations for this purpose were based on September and December 2020 waived family fees that were reported by our contractors. So in addition, part of that 110 million, there was 80 million for CAP, California Alternative Payment Program, or CAP, Migrant Alternative Payment Program, CMAP, Migrant Child Care, CMIG, General Child Care, which is CCTR, and Family Child Care Home, CFCC contracts to support the over earnings due to serving school-age children full-time. So the CDE had released a survey to assess the costs of over earnings due to school-age children receiving care full-time. And this survey had been open to contractors between December 28th and it closed January 11th. So allocations for this purpose were based on the survey responses that we received from contractors, as well as subsequent information provided to our office when additional information was requested. So that's how we are allocating that piece. And then also we have determined that we have additional resources to extend the timeline of temporary emergency childcare services beyond the initial allocation. So back in December, we had released 49 million of the 80 million to extend services for essential workers enrolled in emergency childcare. Those were expected to extend services for all children through May 31st, 2020. We had held some funding aside to ensure that the priorities were sufficiently funded. And then a second round of allocations are going to be forthcoming. And that is based on the December 2020 reported emergency childcare data. So that was submitted by our alternative payment contractors on the December caseload report. And so the funding that you're going to receive for AP contractors, you'll be funded both for the over earnings due to school-age children if you responded to that survey, and then also to extend care for those enrolled in emergency child care services through the end of the year, so through June 30th, 2020. So as I said, we've been working on it. So Child Development and Nutrition Fiscal Services, we completed our allocations. We'll be sending over all of these amendments to the CDE contracts office today. Contractors will be notified just like we have in the past, of the augmentation amount, and that notification will probably come next week from your fiscal analyst. And contract amendments for these purposes outlined on this slide are expected to be emailed to contractors no later than February 22nd. So as always, if at any time a contractor believes they do not have sufficient funds to cover costs related to either ongoing enrollments or emergency childcare enrollments, please always reach out to your fiscal analysts, and then they will bring it to our attention as well. So then next slide, I just wanted to touch a little bit about family fee augmentations for CAP contractors. So on or around December 18th, 2020, CAP contractors received a contract amendment that included an augmentation for July and August family fee waivers. At the time, our office determined allocations for the July and August family fees. We did not have actual data from what was waived during that time period. We understood the urgency for these funds, and the augmentation was therefore based on the average of family fees collected over 3 years. So while reviewing the data that we received for the September through June allocation that we are putting out this month, we also reviewed all data that was submitted on the line waive family fees for certified children July and August to determine whether contractors were sufficiently funded for July and August waive family fees. And so contractors whose July and August allocation was less than the reported family fees for, that was reported on that line, that waive family fee line for that same time period, will receive an additional augmentation to cover that shortage. So that will be included in the forthcoming amendment that should be received at the end of, or by February 22nd. So that was to kind of true up the data. So I'm going to now turn it over to Alana again to facilitate the live Q&A session.
Fabulous. Thank you everybody for the full engagement, and thank you to our staff. We've been trying to answer as many Q&As as possible, and just note we will not be able to get to all of them. We are going to try. So let's see what we shall pull out. I do know that the new MBs were a popular topic in our Q&A. So I am hesitant to pull Danielle off of answering a Q&A, but perhaps we can ask her to come back and speak to the abandonment of care policy. A few folks were saying that they had a hard time understanding everything that you said. So perhaps we could just go back to the slide of the abandonment of care and have her read that once more, and hopefully this will clear up some of the questions that we have in our Q&A.
Sure, no problem. Sorry, I'm now seeing all the comments that said it was a little bit too fast, so I apologize. Again, I'm going to very much encourage everyone to read the management bulletin and the implementation guidance, because I can guarantee you that I'm just giving you a general overview of the policy, and I'm not stating every little nuance that is in the management bulletin. So for this exact policy, please refer to the management bulletin to make sure you are meeting all of the requirements and making sure that you are understanding all of the parts to it. Just in general though, the abandonment of care policy is going to require providers to notify the contractor after 7 consecutive calendar days that the family has not been in care and has not notified the provider of the reason that the family is not using services. Once that happens, the contractor is going to attempt to contact the family. They're going to use a variety of communication methods. And then if the family is not in contact with the contractor or provider after 30 consecutive calendar days, then the contractor is going to issue a notice of action to disenroll the family on the basis of abandonment of care. It's important to note that you're going to notify all families by April 2nd of this new change to abandonment of care. And then, Alana, I've also seen a lot of questions about people asking if families do not recertify within the 50-day period, the new recertification timeline, are these families being disenrolled based on abandonment of care? Just to clarify, if a family doesn't recertify, that is not an abandonment of care, but a family may be disenrolled if the family does not meet the recertification requirements, because all families must be recertified within the timeline required. And therefore, you could still disenroll the family if that was the case, if they didn't meet the recertification requirements, but it would not be on the basis of abandonment of care. So hopefully that clears up just a few of the questions that we had in there. And again, I'm going to say this one more time. Please look at the management bulletin for the exact guidance on exactly what steps you need to follow as the contractor, as a provider, what the parent needs to do, just so that you are very clear on those requirements. And then if you have any questions, please send them into ELCD Emergency. We would love to take any of the questions that are not answered today and turn them into frequently asked questions. We will post them on the website. So even if I don't get to your question today in the Q&A, just please note that they're not getting lost. We are taking them back, and they will have an answer, I promise. And then a lot of people had asked what section it was in the implementation guidance. So I will say one more time that it's in section 18066.5 of the implementation guidance. And that is 18066.5 of the implementation guidance that you can find the abandonment of care policy. Okay, back to you, Alana. Hopefully that answered some questions.
I think it did. It's a lot of new information. I appreciate you, Danielle. And we are unfortunately running close to 11 a.m. So while our Q&A team is still answering Q&As, I'm going to start reading the resources, and as we inch towards the last bit of the hour. So to see our webinar slides, including this one, in the future, whenever this gets posted, and all of our management bulletins, including the ones we spoke about today, our frequently asked web pages, that can be found on the ELCD COVID-19 guidance webpage at https://www.cde.ca.gov/SP/CD/RE/ELCD COVID-19.ASP. You may also submit additional questions to the ELCD emergency inbox, which is elcdemergency@cde.ca.gov. And thank you, Brittany, for putting them in the chat. To contact your assigned PQI office regional consultant, a list of consultants can be found on the ELCD consultant regional assignments webpage at https://www.cde.ca.gov/SP/CD/CI/assignments.ASP. It is good to note that consultants are more easily reached by email, but you can also call the office at 916-322-6233. And also to contact your child and adult care food program county analyst, a list can be found at https://www.cde.ca.gov/ls/NU/CC/CACFP contact.asp. To access the main page of the Child and Adult Care Food Program and where to find links to trainings and so much more, please visit https://www.cde.ca.gov/ls/NU/CC/CACFP /CC. For more information on the Master Plan for Early Learning and Care, please visit https://www.chhs.ca.gov/home/master-plan-for/early-learning-care/. And now I would like to invite Erica and Stephen back for our closing.
Thank you so much, Alana. In closing, just want to thank you for your continued dedication. Remember that PQI consultants, administrators, managers, and me, we are available to you. Lastly, please take care of yourselves. You can't pour from an empty cup. Thank you. We'll see you February 19. Over to you, Steve.
Perhaps there was another glitch.
Steve was having a technical difficulty. Steve was having technical difficulties, so I don't know if he's able to join. Oh, he's here.
I'm sorry. I'm joined by phone, figuring out what to unmute. Sorry. So on behalf of the team at CDE who are continuing to work to best support children, families, and provider professionals, we thank you for taking time out of your day, your morning to listen to this morning's webinar. We hope you'll join us for our next webinar, which is scheduled for Friday, February 19th, 2021 at 10 a.m. With that, please take care of yourselves, be safe, and be kind to each other. We can't do this without you, and we're looking forward to getting back to normal. We'll get there together. Thank you, everyone, and we hope to see you next time.